In the name of God, most gracious, most merciful, ladies and gentlemen, welcome to the press conference for the National Task Force for combating coronavirus, COVID-19. At the beginning, we would like to welcome the speakers, Her Excellency Dr. Faiqa Saeed Al-Saleh, Minister of Health, and Lieutenant Colonel Dr. Manaf Al-Qahtani, Head of the National Task Force for combating coronavirus, and also Dr. Jamil Salman, Infectious Disease Consultant at Salmania Medical Complex. At the beginning, we would like to emphasize that this press conference is going live in Arabic, English, Indian, and Urdu through the website of the Ministry of Health. Now we begin with Her Excellency. Please proceed. Peace be upon you. Good evening to you all, and welcome to the media cadre in this press conference. At the beginning, I would like to start by expressing our sincere thanks to His Majesty King Hamad bin Isa Al Khalifa, King of the Kingdom of Bahrain, who has given us during the yesterday's meeting in the Council of Ministers his royal guidelines and support, which made us as citizens to be assured, because we have a leader who protects the citizens and residents. And also, my sincere thanks go to His Royal Highness Prince Salman bin Hamad Al Khalifa, the Crown Prince, for his ongoing follow-up and support in relation to the virus, and to be every updates and give all the support to the team, and especially His Royal Highness established the team before receiving any case in Bahrain. So His Royal Highness had a vision when he established the task force headed by Dr. Sheikh Mohammed Al Khalifa, who have done great efforts in developing plans before receiving the first case domestically, and to work and follow up on all the team 24 hours with Dr. Sheikh Mohammed bin Abdullah Al Khalifa. And we also thank our colleagues in the Kingdom of Saudi Arabia and the United Arab Emirates for having contact with us, and we had all the precautions in relation to the necessary steps before receiving any case in Bahrain by conducting meetings with the ministers of the GCC countries in Riyadh in 19th of February, and we have reviewed all the necessary steps and precautions that in which we have exchanged experience, and we have continuous contact with the ministers of health, especially in the Kingdom of Saudi Arabia and the United Arab Emirates. So we express our thanks to them for supporting the Kingdom of Bahrain. All the teams are, it's not limited to the Ministry of Health, but all the ministers and government entities and also non-government entities, we continue to combat this this virus, and we have coordination with the Ministry of Interior, with the BDF, with the Ministry of Transportation, with the Ministry of Information, and each body concerned, the Ministry Supreme Council for Justice, and a number of bodies and organizations who have worked very hard to spread awareness in the community. And so we can say that the Bahraini team has proved to be a real team in this field, and they have taken all the proactive steps and efforts in their work, each in their field. And we do not forget the media, of course. You, as media, have got great efforts as journalists, as writers. We express our thanks to you by expressing to the people, because it is a national safety and national security. So by working together, this is what we wanted, and this is the real nature of Bahrainis and the real nature of our brothers and sisters in the GCC countries. Today, I've visited a number of places to be in close contact. We know that there are professional medical teams who are doing their best, and they have proven their rules and their sacrifices they're doing, especially like some of them were retired and they took the initiative to work with us as one team. And I have reviewed the ongoing work they're doing, and this is really expected from them. They were doing their best as a one team, and we cannot forget that they have a one integrated team from the Ministry of Interior. Without this ministry, we wouldn't be able to work alone. So they have done great efforts. So we are assured that all the precautions done, thank God, they've gone very well, and it is just a temporary crisis, and we will forget eventually by treating all the citizens and having them back to their home and having the normal life as soon as possible. And thank God, we can assure that the cases are stable, which makes us assured, and they are receiving the sufficient treatment and the continuous treatment as part of our duty, not just as a Minister of Health, but all the officials in this kingdom. They pay due attention to the citizens and the residents in the Kingdom of Bahrain to avoid any pandemic in Bahrain. And with the recognition of the World Health Organization, Bahrain is away from the epidemics, and we thank the regional and international organizations like the World Health Organization for following up with us in these matters. And now everyone knows, like yesterday, the regional head of the World Health Organization visited Bahrain, and he appraised the steps and precautions done in Bahrain in this field, which made us really further assured. Now, for the testing and the isolation, the quarantine are done all as expected, and I'll leave the steps in relation to the current situation to Dr. Manaf Al-Qahtani. You've seen over the past times his efforts in, and also Dr. Jamil Salman in updating us on these cases, and we hope that this press conference would be useful for everyone. So I'll leave the floor to Dr. Manaf to keep us updated. Thank you. Thank you, Your Excellency. Peace be upon you. Good evening to you all. I'm not going to go long. I will just highlight the 3 pillars. First, it's very important to go into the the time with all the procedures we've taken as a national task force to combat coronavirus. The next pillar, we're going to talk about the methodology of our work in order to combat or avoid the spread of this virus. And the third pillar would be about the updates on the cases we have and the testings were done. So let's talk about the time periods. On the 11th of February, His Royal Highness the Crown Prince has directed to launch an operations room, and on the 13th of February, this room has been launched to combat the coronavirus at the Crown Prince Center for Training and Medical Research. On the 14th of February, we were ready at the level of the media, and there was approved by the disaster management, and we were trained to deal with this at the media level. And within 4 days, from 14th to 18th of February, we have assessed the preparedness and the readiness of us. And so we've created different scenarios just in case, God forbids, we've received a case or more than one case. And then we activated the operations room at the Bahrain International Airport. And it was that place that we thought about of receiving any suspected case. So we've created a small room similar to the one done at the BDF hospital, and we have activated the hotline 444. And the 21st of February, we have stricted the precautions at the airport, and we have stopped at the access for the people coming from different countries with high risk of this disease, and we have prepared the places and updated the places in which we're going to deal with the cases and treat them. And on the 22 to 24, we have created a tent for around 2,000 persons to be to receive those people which was near the airport. And on the 24th February, and I think everyone knows, we have identified the first domestic case for a person coming from Iran. And on the 29th of February, our team have done great efforts by activating the mobile testing units for those citizens who were outside the country before activating the resolution. And there was great participation from our citizens, which reflects the awareness and the readiness of the citizens. And now the second pillar in our plan, which is the steps that we've taken to avoid the spread of this virus. First, the National Taskforce, headed by Dr. Sheikh Mohammed bin Abdullah Al Khalifa, head of this. We have developed the strategy and the plans that we're going to follow as a national task force. And the media was very important, and we have received training on how to deal with the media in relation to cases or the suspected cases of this virus. And you've noticed all the posts and all the news around the kingdom. And myself as a doctor, and I've always dreamt of as a doctor, we have agreed on conducting research and in relation to this virus, coronavirus. And we have always dreamt of having these research published from the Kingdom of Bahrain, and we had experts, and I am optimistic that our experts in Bahrain would spread research in relation to this field. As for the tracks, we have 5 tracks we worked on. The first track, and I always remember, identification of cases. The second track, the treatment, once we identify it. The third track, those who had contact with the people, and also the fourth one would be the securing the accesses. So we have set a hotline 444. People might just, they know we had built the capacity and we've done great efforts and we've overcome the obstacles that we had at the beginning. And also we have added the electronic registration, which reduced the load on the hotline. The second point, in terms of treatment and the quarantine, we have provided all the necessary equipment and tools of, we have the quarantine, for example, if the infected patient has a virus, where they're going, and if they had contact, where they're going. So we had a smooth procedure just to avoid the spread internally. And also the securing the accesses, not only the airport, we've gone to the bridge, the causeway, King Fahd Causeway, and also the ports. We've done the plans necessary to secure these accesses just in case we received any cases, and also all the necessary tools and equipment. So the Kingdom of Bahrain, thank God, they provided all the necessary medical and identification tools and within the international standards. And we shall not forget the manpower structure. So the medical cadres who were with us, and they had already retired, they also joined us back, and there were so many volunteers, so we express our thanks to them. They came to us even without asking them. So that was very important in building the capacity to combat this virus. So we're done with the time periods and the methods. Now the third pillar, which is the current situation in terms of the confirmed cases according to the laboratory tests. So thank God, up from yesterday up to now, we have 49 cases, and Dr. Jamila would talk about them in details. Only 2 cases that they need to take medication of coronavirus. And a very important point, which I am very proud of as a Bahraini, to see the mobile testing units within 3 days. I don't have the statistics so far, but they have collected 1,200 samples of those individuals before for those people who were not before the issuance of the resolution. So I assure you 600 samples are negative, and we're still waiting for the remaining samples, which we hope that they were going to be negative. So that would really confirm the stability for the cases. So the work is ongoing. They're going in smoothly throughout Bahrain without any issues according to the schedules. And for the news you've heard yesterday, to which we were really happy about, which is the 12 people who went out of the quarantine. I personally was very happy. So having them out of the quarantine is a positive indication, and I'm sure that we're going to have more positive news. And after the 14th day, after having them in a quarantine for 14 days, and we have done the lab tests just to make sure that they are safe and healthy, and thank God all of them were negative, and we were really happy. So hopefully they will go back to their normal life, and hopefully that will be for the rest. So thank you very much. Thank you very much, Your Excellency, and thank you very much, Dr. Menaf. And now, as for the patients we have, now we're talking about 49 cases uh, in confirmed in Bahrain. 47, they're not taking any medications. We're talking about these. 47, they don't have any symptoms. So over the coming days, you're going to hear about them having them out of the quarantine. As for those who are confirmed, they're taking the medication for the COVID-19 because they're having uh, uh, medical conditions existing. So they might be like under pressure or having more for some cases. As for the health conditions for those who have contact or returnees or those in at the quarantine, they don't have any symptoms, and as mentioned by Dr. Manaf, we're waiting for them to finish the incubation period, the 14 days, and before leaving the quarantine, we're going to double check by conducting tests just to make sure that they can go back to their beloved and their families. As for the patients, we're having them in the isolations because we received from the families and when they're going back and how they're going back. Well, those patients were going to follow all the recommendations by the World Health Organization. So each patient, once they are recovered and they don't have any symptoms at the, we're going to retest them every day, 2 3 days, to make sure that they are negative. They need 2 consecutive tests to make sure that they don't have the virus and so that they can go back to their families and beloved people. And so we have a group of the people that they show positive signs that they lack the virus. So over the coming period of time, you're going to hear more people going out of the hospitals and hopefully more and more going back to their homes. Thank you very much for the speakers who have explained the national efforts in combating coronavirus in Bahrain. And this is the full scene of this. Now we'll leave the floor for the questions. Hopefully we have the different questions. Let's start with our brother from Kingdom of Saudi Arabia. Please go ahead. Good evening, Badr Shihri from Al Arabiya and Al Hadath channels. So 49 confirmed cases at in the Kingdom of Bahrain. There was a number of 12 cases leaving the quarantine yesterday. We want to know more about them. And if there is a number for those people who had contact, because most of the cases in Bahrain coming outside the borders, they were not registered locally. So just to know the number of those suspected in the kingdom. As for the 12 people, they came from Iran through the incubation since they left the border in Iran to Bahrain. So when we checked them, they were negative. So we put them in at the quarantine and not the isolation because they just had the suspected. So to double check if they had any increase in fever or any other signs similar to the flu. So all these 12, they did not have the signs and the symptoms. And we have done the tests because, as you know, over the 14 days, it could go back without any symptoms. So we ensure before leaving the quarantine that they are negative and they are healthy. And so we did that and they are healthy. And hopefully we'll have more. So if they are not infected, it means we don't have other numbers who had infected. If we say those people who had contact, it means with those people who were infected. And those 12 are not infected. Go ahead. Ahmed Abdul Hamid from Akhbar al-Khalij newspaper. At the beginning, thank you very much for your great efforts in assuring the citizens and residents in the Kingdom of Bahrain. It is great efforts. So also the meeting with the World Health Organization, were there any recommendations raised to the Kingdom of Bahrain? The second question, there were some procedures taken by the United Arab Emirates to evacuate their citizens from Iran. So do you have any coordination to bring back the citizens of Bahrain from Iran? I can answer the part in relation to the World Health Organization. Well, this organization has a role like in case where they have the virus around the world. So what it does to make sure the readiness of the countries and to make sure that they're doing all the necessary procedures. So we have the regional office coming to Bahrain as part of the regional tour, and they started with the UAE, Kuwait, Kingdom of Saudi Arabia, and then they came to Bahrain just to check the procedures and the precautions. We've already raised a report to them, but they wanted by themselves, by the head of the regional office, to come here and check, and they have expressed their appreciation for having the steps, because we're following the regulations and the steps of the World Health Organization, and we made it clear that we did that. And so such visits, they're coming from time to time just to make sure that we are in line with the WHO. As for the second part, as for the UAE, by taking a decision, bringing back their citizens. I always say, like, each country has their own way of dealing with their, so I'll leave it to the UAE themselves. Jamal Yaqut from Al Jazeera newspaper, Saudi Arabia. I am the head of the office in Bahrain, so on behalf of the number of journalists and press representatives, we express our sincere thanks for His Royal Highness Prince Salman bin Hamad Al Khalifa, the Crown Prince, for his follow-up and to ensure that the safety and health of the citizens and residents in the Kingdom of Bahrain, and to head the efforts for combating this virus here in the kingdom. So, Your Excellency, the Minister of Health, you mentioned that there is coordination between the ministries of health, the GCC countries, and also between Bahrain and the Kingdom of Saudi Arabia. And this bilateral relationship between the both countries. So my question is, the national customs in the Kingdom of Saudi Arabia has declared to stop receiving any equipment and health tools for corona. And so from all the accesses to be stopped, exported, whether on boards, land, and airports. So how would you do these procedures and coordinations by doing such a decision? Have you reached one coordination? Because we're on a level of transparency. So when we're talking about the Kingdom of Bahrain and the Kingdom of Saudi Arabia, we are brothers and sisters. We're just in one unity. We have one security. So thank God, we really have coordination, and through His Excellency the Minister of Health in the Kingdom of Saudi Arabia, Dr. Tawfiq Al-Rabi'a, by supporting and helping us by providing all the necessary tools to be uh, we've sent to the Kingdom of Saudi Arabia. So we had no issues, and we thank his uh, the King of Saudi Arabia by following all the necessary steps at the in this field. And you would notice even the accesses, we have one accesses, so we had no obstacles in this field. Thank you very much. Another question? Peace be upon you. Thank you very much. Your Excellency, and also Dr. Manaf and Dr. Jamila. My question, the mobile testing units have faced some obstacles. What were the most important obstacles? How many obstacles and how many units, and are they enough? As for the hotline trouble for, how many calls received so far? Are there any investigative bodies for those who are not calling this hotline? As for the mobile units, over the 3 days, as I'm in contact with them, they were so glad. The medical cadres, I have some photos even for them. They are so much involved between them and those their testing. So they had no obstacles, except maybe they had some maybe physical tiredness, because they're working for long hours to cover like a number of 600 people, and it is not a small number. So the efforts done by is like over 1,000 of samples, which is really great effort. And we're talking about samples like 1 to 2 to thousands, and we have those 24-hour team working over these days is really huge. So I can say there were no obstacles. There were just involvement between the medical team and the people being tested. As for the hotline trouble for, I don't have a specific number, but I can see there were just more load on the number. They were over the expected and for the team prepared for receiving the calls, and maybe now they can see the difference. Having the electronic registration has reduced the number of the calls. Maybe the percentage of the queuing is 0, whether on the busy times or and maybe we've just received a call maybe 2 hours ago. So that's also great effort for the trouble force. Also, just to comment on the mobile units, today when I visited them, I have seen them. They were like bees. They were working like bees. They were like doing their job actively without any reluctance, and they were in a very organized process. And I don't think that we have any such smooth processes in other countries. We're talking like for 3 days, and for the 3rd day, and they are really like feeling so much happy doing a national obligation. So having this within their spirit is something good. And I could say, yeah, maybe I even asked them, do you have any obstacles? All of them answered by saying, no, we feel comfortable as long as we have a leadership supporting us and motivating us. So I have sent them a message from His Majesty and from His Royal Highness the Crown Prince, thanking them for their efforts. And so all the efforts, whether from the Ministry of Health and Ministry of Interior, and it's just a couple of days and they're going to finish this. From the Bana newspaper, news agency, as for those 49 people, 49 cases. We said like 12 out of the quarantine, and they are not infected. So when can we see more of those infected? Are there any indications maybe by the end of this week, maybe they would finish 14 days? And also another question, when are we going to receive more Bahrainis from those people who are expecting to return to Bahrain from the outside? Thank you very much. I think it is two parts. First, those 12 people out of the quarantine, they have returned from infected countries, so they have finished the 14 days, and before they went out, we tested them to double check that they don't have the virus. As for those who are infected and they have entered Bahrain, and we said because of the precautious steps in all the accesses, so all these cases were discovered through the airport, so they don't have symptoms so far, but due to the international standards and to the standards of the World Health Organization, so we should do the tests again, and we already did that yesterday and they were all negative, so we're going to do another test also, so and we ensure that they don't have all the symptoms of the lack of breathing or the fever or coughing, but we're going to follow up with them. Not just they get out of the hospital, but also once they get out, we follow up continuously, and also with the people who have contact with them. As for maybe Dr. Manaf, we have a plan and we're ready. We have, according to the cases we receive, depending on the infected countries, maybe we were focusing on the Bahrainis in Iran. So we have all the cadres now are fully ready for the isolation and the quarantines, and hopefully we're not going to have any problems. Thank you very much. Tamam Abu Safi from Al Ayyam newspaper. Last time, just to get the numbers, last time we said 2,292 and only 310 were examined. So out of those 2,292, how many of them like maybe are not yet been examined and maybe now they got the initiative? And also for the medical experts, so we've heard of a case outside Bahrain that have been infected. So do we have any procedures to protect those medical cadres and experts in Bahrain, especially like the international numbers are increasing? As for the samples, I'll leave it to Dr. Manaf. As for the medical cadres, well, I assure everyone that whether cadres, physicians, nurses, we make sure that they are not infected, and it is of our priorities. So all the teams, they've been trained in how to deal with the infected or the suspected people. So we provided them with all the precautions, with the recommendations. They are in line with the combating the infections, in line with the WHO and all the international standards on how to deal with the infected and the suspected people. And they've been trained. Also, as for the numbers, I think I'm left with a difficult question. Well, as for the numbers, the 2292 for the people who entered the Kingdom of Bahrain from before the issuance of the resolution, those people, we started with the conducting the tests through the mobile units, and we have received 1,200 samples, and So far, 600 out of them are negative, and maybe over the couple of days, we're going to finish them. And if we double check that all of these samples are negative, then we can say we'll rest, and then we can think about receiving more numbers. Well, the medical cadres, I think they are by now experts on dealing with any kind of uh, uh, with viruses, and any type of epidemics, and they know how to protect themselves. And the question is like, to what extent you're ready, and we'll always keep this in mind. The last question. You would listen, you would hear about that soon. Peace be upon you. Thank you very much as a team. For Her Excellency, the Minister of Health, do you have any coordination with the Council of Environment? So, coordination with who? With the schools, yes, okay. With the Ministry of Education. Well, maybe I mentioned at the beginning, the coordination is continuous with all the bodies concerned. And we have coordination with the Ministry of Education on a daily basis. Now they have all the schools closed for 14 days for all the government and private schools, as well as the universities. So after this 14 days, hopefully they can go back again. Well, after reviewing the situation, we might have other decisions. But so far, we have continuous coordination with the Ministry of Education and all these schools. And we, at the Ministry of Health, we have a section for the health education. And we're working together with the Ministry of Education. Even if the schools are open again, we're going to continuously look after the students. Do you have any other comments from the speakers? Just a last word. I express my thanks for the media and for their efforts, and hopefully the situations are stable. Thank God for all the cases according to the tests as mentioned by Dr. Manaf and Dr. Jamila, and this is something positive. And hopefully we're going to pass these cases and life would go back to normal. But we emphasize to take the precautions and to follow the instructions available on the website of the Ministry of Health and also the other organizations, and also on social media. We need to educate ourselves, and you have role as media to spread awareness for the health and education of the citizens and residents. So we need it from you to do that, and we thank the Ministry of Information for they are really spreading awareness for people and helping them in protecting themselves. So thank you very much for the media. Thank you very much, Dr. Faiqa Said Saleh, Minister of Health, and also Dr. Manaf Al-Qahtani, and also Dr. Jamila Salman. Thank you very much, ladies and gentlemen.